Hey everybody, it's Dr. V with the Veterinary Telemedicine Facebook community, and I'm really excited today to introduce you to our newest moderator, Dr. Cherice Roth, who it's just such a boon for us to have her here because she is one of the most experienced veterinarians in the field of teleadvice. She is the VP of Veterinary Operations for Ask.vet, as well as a practitioner in Oregon. So thank you so much.
My pleasure.
For coming in. And when I saw you speak at the last webinar, and you had the receipts, right? You had like so much data, and you could just hear like over the internet all these people going, "Oh my God, that was amazing!" So that's when.
Great. Well, good. I'm glad to be making some headway.
Yeah. Well, yeah, and that's just it. And it's funny because I think to some extent it's like preaching to the choir, because everybody who's been in this space is completely well aware of all of this information and how useful it is, and yet everybody else is like such a surprise, like, oh, I didn't know. And you're like, well, that's because every time I tried to tell you about what we were doing, you were screaming that this is illegal. So,
Yep. So it doesn't make for a fun conversation, but now everybody's all ears, so that's great.
Now they're all ears, like, oh my God, that's so great. So I think the first thing to sort of explain, and people get it a lot more than they did 3 months ago, but why is a company like Ask.vet not illegal?
Great. Great question. We're not illegal on many levels. The biggest is because we do not diagnose, prescribe, or treat. So much of veterinary medicine is actually about connecting with that client. Even if you really love animals, there's not a single dog or a cat that I've met yet that has a credit card. And so you do actually have to be able to make that connection and support the pet owner in however they go through their decision-making process. And that's what exactly my doctor team does.
Yeah. And I think that idea of connection, it's so counterintuitive to what people think. They think that this is a really depersonalized service and you're just talking to this faceless bot. And I think over and over again, you just hear these assumptions, right? That, well, whoever I'm talking to must be, I don't know what they think, if it's like an AI bot or some like poorly trained person. I don't know what they think, but for some reason they assume that the person on the other end of the line is not this incredibly highly educated, competent person.
It's hilarious though, because clients especially will be like, wait, this is actually a real vet? And we're like, yeah, that's what we do. That's who we are. Yes. So it's always really interesting to have that part of it. And I'll be really honest though. So we have a really large doctor team. We're over 150 doctors now at this point. And part of their training is the understanding as the medicine is the minimum.
Yeah.
Of what we expect out of these doctors. And so we are selective as far as that part is concerned, because it's one thing to be a really great clinician, totally other story to be a really great communicator, and the population of doctors that we're looking for and that we find have to be both. So it's pretty interesting.
And there's some crazy challenges there too, because there's people that aren't good communicators, even one-on-one, face-to-face. And when you have that barrier of, well, do you do phone as well? So
we do phone, chat, and we offer video, but clients don't ever want to do video.
No. So how the heck do you create rapport over chat? Like, that's crazy.
Yeah. So part of it is the training of the doctors. But truly it's when I get on the phone to interview these doctors, I have to get off the phone feeling like, wow, I really know that person. Because over voice, if you're able to portray that you care, it's using words that you would normally express via facial expression or with a smile or any of those types of things, but actually being able to use the words of, oh my gosh, you're right, he is so cute, thanks for uploading that photo, or gosh, I could see how your pet walking like that could be really scary. Even if you in clinic, you can go, oh, right, but that you can't portray that via chat or text. And so it really is verbalizing how you actually feel in that moment with that pet owner.
I was doing some research on patient-centered practice on the human side, because of course that's been quite well documented for a very long time. And
Yeah.
it was so fascinating how they were talking about the biggest predictor of outcome was a good outcome happens when the patient thinks the doctor likes them.
Yep.
Which is crazy. Like, I mean, it makes sense when you think about your interactions with your own physicians, because that's like, if they like me, then this is a trusting sort of relationship, which I sort of keep coming back to. But that also sort of makes me sad when I think about how many people are not really happy with clients right now.
Yeah. Yep.
And I think that that's probably a topic for another day. But this is people that love what they do, right? You don't go into this because you don't really like working in the clinic with clients and would rather not deal with them. Kind of the opposite.
Because this is all clients, no putting hands on pets at all. And so it is one of those things where you have to be really confident in the way that you give information to pet owners, and really being strong in and empathizing with them and meaning it, because they can tell when you're not genuine.
You're checking your phone. You
Yeah,
think you can't tell
oh,
that you're distracted.
nothing. Oh my goodness. Wow. Yeah, I could see how that's scary. But they really can read that. I was actually going to share something with you, if you don't mind.
Please.
Each week we do a weekly report for our doctors, and if they show up on the special mentions list, they get this report. And so it's really it speaks to kind of the level of connection. If you can see these, it's such a great relief knowing that I have a doctor for my pets here when I need them, especially during this time in the world where we can't just leave the house and go to the vet for any reason. Thank you to the doctors and to Banfield for this service. So this was one of the Banfield clients that wrote that nice review for us. But it's page after page of all of these types of things. And what that lets me know is we're doing right by those clients and by those pets by being able to make that and voice that connection.
Yeah. It's so fascinating. When I first started this blogging in 2009, and I was so worried that I would be inundated with people asking me for free advice. It's happened maybe once. Yeah. And I said just at the outset, like, hey, I can't. And people are totally cool with that. And yet they feel such this connection simply because they'll comment on the blog and be like, oh God, it was so hard when my dog had Addison's, thanks for writing about this. And they don't need much, but boy, does that speak to some of the deficiencies that we have maybe when we're stressed or.
Yeah. And I mean, even just the environment of the clinic, we for so long focused on the veterinarian being the center of that interaction veterinary wise. And now we're learning that wasn't really true.
No. Well, I mean, in our eyes, right? But
it can't be, because the way that we are honestly really poor at marketing our actual skill set, it can no longer be the center of what we do. And so really bringing that client in, even like the drawings about what telemedicine is, there's always that veterinarian in the center, and I'm always like, no, it's a circle. Put the client in the middle.
So I read a book maybe a year and a half ago that totally changed my worldviews. It's a marketing book. Donald Miller's Building a Story Brand. And he kind of talks about framing our business message in the context of the hero's journey in a story. And so your job when you tell your story, and also just when you go into the room and interact with the client, is the client has a problem and you help them solve it, right? Yes. So the client's the hero, and your job is to empower them, which to me is so brilliant, because the client has a problem, you help them solve it, and you give them a plan. And so I think from a diagnostic point of view, when we go into the room, we're so focused on the plan that we forget that it's actually that interaction of the client and you trusting each other that matters more than anything. So the plan may or may not even involve you. Like me, you may not be the one doing the diagnostics, but what mattered to them was that you helped them figure out what to do. And I think, to me, that sort of that missing key that makes what you're doing with telehealth so powerful.
Yeah, that's exactly right. And it's really interesting, actually, so when my doctors or myself is talking to a client, there's some minimum things in each interaction, right? So being able to talk to that pet owner about what's happening and what they are concerned about, not what necessarily you're concerned about. I mean, you can redirect a little bit if it's like, no, that's not retching. That's actually, there's some other things happening there.
We're going way off topic here, lady.
Right.
But
So,
yeah.
and even being able to kind of moderate those discussions are really important without having the pet owner feel like they're on a time crunch, or it makes them feel like they're the only client that you're dealing with. So it actually gives us the freedom to really talk about what best medicine looks like for that pet owner, without the mitigating factors of, yeah, if I tell you to go into the clinic, I may get a kickback from that. And that's not what happens for us. That we're truly there to empower those pet owners so that they understand the value of, here's why an x-ray of the belly is not going to be as meaningful for your pet today as an abdominal ultrasound. And so really assigning that value, again, to the skill set of what the veterinarians have to offer them, really does lead to a different level of connection and a different level of conversation that they're able to have if they do have to go into the vet clinic.
Do you find that disconnect because the client knows that you're not the one who's going to be seeing them actually makes them more likely to trust your recommendation because they don't have that seed in their head?
100%. And you know, we actually very often get, hey, my doctor said that we need to do X, Y, and Z, but I'm a little bit scared because it costs a lot. Can you walk me through that? And so there's two layers there, right? There's gosh, what kind of trust did they have with their clinician? Was it communicated the right way? And honestly, as someone that practices, I know the level of conversation that I have with my pet owners, but the minute I say cancer or the minute I say surgery, they're shut down.
Yeah.
There's no harm for them to do that because it's protective, right? We're talking about their babies. And so sometimes it's just being able to do that assist of, wow, I can actually really see the value based on the things that you've told me of why your doctor recommended running a senior panel on him, or why it's so important to get that cardiac ultrasound. Yeah, gosh, it sounds like, you know, really being able to really assist. And what that does is, again, it makes the pet owner the superhero for their animal, right? And that they're like, yeah, I spent all that money on them, but here's why I did it. Versus the people that leave the vet clinic with like a $1,600 bill and they're like, what the hell happened?
Yeah. And then they go online and find somebody to, you know, convince them about why the vet was so horrible.
Yeah, exactly.
That was one of the things that surprised me the most when I was working with Whisker Docs, which is another great team doing the tele-advice, is I don't think people understand that the veterinarian staffing these lines are actually here to help you and have your back. They're not here to take your clients. Actually going to make your relationship better.
And that's, I mean, that's a battle I've been fighting for 4 years now, 5 years almost, in that you're exactly right. And not only that, the clinicians that we hire have to be good doctors. They have to talk about diagnostics. They have to give differentials. They don't have the liberty of looking at an ear and going, oh, that looks like a yeast infection. We'll just do some of this. They have to talk that client through A to Z every time, because we don't know what we don't know. And so what it ends up being is that pet owner is being maximally educated on any of the things that could be going on in their pet. And what that does is it sets their vet up beautifully for a really deep conversation that's far more meaningful than the, well, gosh, you talked about a lot, let me go home and think about it.
Yeah, that was kind of one of those things where so I started practice in 2003. So they didn't tell us in school what to do with people who printed stuff out online because it didn't exist yet.
Mm-hmm.
It was maybe a year or two before the Yahoo thing started coming in. And it was always sort of met with this universal dread, like, right, what did you find? Except for those people that, you know, actually came in and found some good sources and is like, oh, thank God.
Mm-hmm.
My life just got so much easier. Like, you know, the internet or like other sources of information can really be, they're not always going to undermine you. It's just a matter of helping people find the right ones, because you can't spend that hour and a half with the person 2 hours after they go home and they start Googling what lymphoma means. I mean, you could, but you probably don't want to.
No, because you like want to have a life and things like that.
Yeah.
And what's the other part that's really interesting about that is I actually love those clients that come in armed and ready to talk.
Yes.
Right. And if, who else better, like if you're going to have your clients find information from some other source other than you, damn, it better be another vet, right? Like, It could be anybody else. Who you really want is for it to be another vet. That's really what you want. And that's what the clients want too. They don't necessarily want to have it be some random backyard breeder answering their questions. They don't want it to be Google. They don't want that, but that's the level of access that we gave them. So they did whatever they could.
I had asked this Facebook group that I've had for 10 years now, and it's mostly pet owners, like, hey, would it be helpful to you if I just listed sites that I like and trust for information? Like an Angie's List for veterinary stuff. And people were just like, please, it's so thirsty for that information, because I think, like you said, people do understand that there's a difference between good information and bad information. But if we refuse to give it to them until they take time out of their day and come in and sit in that room, then we're really doing everybody a disservice.
Absolutely.
Trust somebody else. So you had mentioned, and I think this is awesome, how important it is to have like the best people who can communicate. I think another sort of misperception that I see quite a bit is that when somebody calls in to these lines, the person on the other side is just kind of spitballing, So I was shocked in the most delightful of ways at how amazing these clinical algorithms are in terms of, wow, and I think if anybody's read, it's Atul Gawande. I think I forget. It's he's like a great physician, and he's written a couple books, and one of them was about checklists and how, like, stop freaking out about checklists. They actually give you better results, going through this set series of things. So can you tell me a little bit about training and how you get your doctors from starting to, this is fantastic, all those great 5-star things?
Yeah. So like I said, a lot of it is selecting for the right personality. Medicine you can teach, VCPR rules you can teach. So it really is about selecting for the right personality, that they're okay dealing with ambiguity, number one. And so from there, they go through our virtual care university. We have race approved aspects of that walks them through, this is what telehealth is, this is what telemedicine is, here are your lines, and these are your guardrails. And walking them through that before they ever are able to even talk to a client. Yeah. So that's the first part of it, is really educating them on what their role is and how we see the veterinarian fitting into the life of the client and meeting that client where they are, if it's texting you from the bathtub or wherever they are. Literally.
Mostly not on live video.
Hopefully, mostly not, like really, really not. But yeah. So
we speak on live video.
That part of it. The other thing that I think is really very important is we talk to each other all the time. We use Slack as a company, and we have DVM only channels. We have medical question channels. We have DVM mentors that are available to answer those if it's a question that I can't necessarily get to. And what that does is it expands our breadth of knowledge. And it also gives us the coverage. I mean, we're all over the US. I have some doctors that are US licensed but live outside the country. And so it really does give us that ability of, like, for example, I had one of my doctors on the medical Slack go, what the hell is a banana slug? And why is this dog eating it? And we're like, oh, okay, no problem, because we're in the Pacific Northwest. Let me tell you about that. Yeah. But that's really how we're able to provide that stellar experience for the client, is that we talk to one another. Every successful clinic, every successful medical team has to be able to talk to one another, has to be able to say, I don't know. And that's very much so part of their training, that, hey, if it's not clear, understand that there is someone that's online with you. We never have one doctor on at a time, ever. Back in the day when we had like 10 coming in, yes, of course. But they're never alone. And that really does give them a lot of confidence in being able to make that connection, figuring out what that pet may or may not need, and then giving guidance after that. So that's how they're trained.
So you had mentioned earlier, before I hit the record button, that in your state now you can go from soup to nuts. You can actually do telemedicine with a remote VCPR. So How has that experience been going from somebody who's already really, really well trained in all of the other important stuff, being able to have that extra element? Has that changed a whole lot of what you do?
You know what it's done is it's actually relaxed me quite a bit. And the reason why is it's true. I mean, because there are so many pets that it's like, well, gosh, I know that you're 80 miles from the closest emergency room, but if I give you this dosing, then technically I'm breaking the rules. But what's best for the client and what's best for the animal? And so actually, in the state of Oregon, when I'm talking to clients remotely and forming that VCPR, I let them know, hey, look, there are some things that I'm going to miss that I may not be able to see or touch or feel or smell, right? So I'm really going to lean on you. And my doctorate is in medicine, yours is in your pet. And what that means is that this is a two-part responsibility relationship. And again, it's one of those things that I get to talk about best medicine without it feeling threatening. I'd say 85%, if I had to kind of ballpark with all of my doctors doing telemedicine, it's about 85% of those visits, start to finish, new client, hey, wow, yeah, I'm really concerned. Thank you so much for connecting with us. Here are the diagnostics that I think I need in order to help you. Your pet sounds like it's in pain. Why don't I go ahead and script that out for you, at least something to mitigate the pain while we figure out what's going on. And you're never going to, you're never going to do harm for a pet by relieving their pain. It's part of our oath. Those are the telehealth questions that are difficult. That's when it gets hard, when it's like, I really want to be able to tell you to do X, Y, and Z, but I can't. So being able to do this is everything. Most of those dogs, cats, and I see anything that'll fit in the door, the pet owners are just so grateful. So grateful. And there are things that we've been able to catch. Like, yeah, I know that you gave flea preventative, but that actually looks a lot like it could be Demodex. Come on in for a skin scraping. And really helping to walk them through the value of that skin scraping. And so when they get there to drop their pet off, especially since we're still doing curbside, they understand why they're there. They understand what to expect. And they typically already know the cost of it as well.
Yeah.
And that really does help the clients tremendously be able to budget for when they do the drop-off appointment, what level of urgency they need. They get the chance to apply for care credit or scratch pay before they're even in the hospital. And that alone mitigates a lot of stress for them.
One of the things I think you brought up about clients being grateful and my frustrations, not just about being in California now, but just about being a veterinarian in general, is there's this perception that the worst thing that can happen with telemedicine is that a doctor is going to miss something. And I always think like, okay, well, maybe, but that's really not the worst thing that's going to happen, right? The worst thing that's going to happen is that person doesn't talk to any veterinarian, anybody with knowledge, and they find some horrible thing on Google and the pet suffers. Like the risk, like you're willing to throw away all of this benefit because you're worried about this one little risk that we just haven't seen play out.
Yep. Yeah. And that's the thing. And, it's interesting in that I agree. The level of fear of missing something. Like, how many of us have been in clinic and missed something? Like, let's just have a real conversation about this. I can have the pet in front of me.
Yeah, and when the cat's like, you're not going to feel anything, man.
I'm like asking the cat, why are you limping? They're like, I don't know. There are things you're going to miss in the clinic. But what you won't be able to miss is, wow, that pet's in pain. Let me help. Yeah, Miss Jones, you're right to be worried. Or, you know what? I'm not super worried about that. And here's why. And then if you aren't really worried about it, here's when you get worried. And really signposting for them so that they become the expert in their pet. Like, you know what? Yeah, he vomits once a week. Okay. Like, how long has that been going on? Is that bothering you? And really kind of helping them to investigate these aspects of medicine that they may not actually see as a problem that we're able to interpret for them.
And I think that idea of the signposting that's such a great point, because I think anybody who's talked with somebody through end of life care knows clients will fixate on one thing and miss all of these other things. Like the dog's gums are white and he can't move. I'm like, but he's still eating. Like,
yeah.
well,
his tail's wagging. I'm like, yeah, okay.
It's a lab.
Mm-hmm. Yeah,
I expect him to continue eating for, a couple minutes after I finish the injection.
Exactly. Yeah. And so it really is about helping them to interpret and giving them that level of support through that. Because what happens is that we've done hundreds of thousands of these interactions at this point, and it's every 10 that you can very easily pull up any session and the pet owner will go, gosh, I had no idea. So it's really about supplying them with that aha moment, and that, oh, you're opening the door for them to understand their family member better. And that's where that level of gratitude comes from. It's rare, so rare, even though we're not prescribing or diagnosing or treating via teletriage. It's so rare to have a cranky client.
Which is amazing, right? Compared
so
to being in the clinic.
Yeah, it really does. Like, it's that level of thank you for being there. We haven't inconvenienced them. They're able to seek our knowledge on their own terms. And, it changes the dynamic so much because they're there strictly for our knowledge.
I think one of the things that surprised me the most in my entire career was going from ER to hospice care, and people were so much more appreciative of a good euthanasia visit than they were when you actually save the pet.
Mm-hmm.
And makes sense in the context of communications, right? But we think that our job is to fix the medical issue, but the job is to alleviate anxiety, right? And help them understand that the decision that they made is the right one.
Yep.
And to me, that's sort of the great advantage of all of this is just that education. And maybe this is the push that'll make us become better at that. Maybe.
I mean, we have to. Yeah. We have to, because the reality of it is clients are savvy now. They know that there are clinicians out there that care about what their experience is like interacting with a veterinary professional.
Which is good, right? I
think so. And the thing is, a lot of us do care. A lot of us do care. I think that where we went, I guess if I'm going to use the word wrong, is that we were taught that we're the center of the interaction.
Yeah. Well, that's all of medicine. I think we're all sort of making that right-hand turn for a good reason.
Yes.
So with all of the hundreds of thousands of interactions, yeah? What are the most common reasons people call?
Ooh, vomiting, diarrhea, skin. We separate out ears just because we get it so much.
Wow.
Eyes. And my favorite is this normal?
And how often is it normal?
70% of the time, it's usually normal. We've been getting a lot of tick owner diagnoses, and it's actually a nipple. People are just at home spending more time with their pets, looking at places they haven't been looking at because they're bored. But yeah, most of it is, oh my gosh, has my dog always had this divot on the side of his ear? Yes.
Yeah.
Called the Marginius sac. Yes. And they go, oh, I thought it was an old cut. I mean, so many of these, like when we say 70% of our interactions don't need to go to a doctor, that's why. It's because these pet owners don't just come to us with, my dog's arm fell off, he's limping, he's vomiting. It's normal everyday questions. Most of the time we meet them with something wrong with their pet, but what keeps them coming back is that they know we're there. Yeah. They know that we have their best interest at heart. And so they come back and they ask us, hey, I'm in the aisle and I'm looking for an over-the-counter flea preventative. What do you think about XYZ? And then we get to have that conversation of, let's talk about the difference between orals, prescription, and non-prescription topicals. Let's talk through that. Or my favorite is they will send us a picture of the food aisle.
Well, at least they're asking you.
They're totally asking, but
not the person in the apron.
Right. But here's how pet owners, if they didn't have us to reach out to, the way that they pick what food they take home is they take the smallest bags. The first choice is, does it have a dog that looks like mine, or does it have a cat that looks like mine? That's how they pull it. Then they go, oh, does it have grain? Yes or no? And then from there, here's what's crazy. And when we talk to our clients and, you know, we're able to send out surveys and things like that and figure out what they're thinking. A lot of pet owners will tell us, I just go get a whole bunch of small bags, and then whichever one my pet eats the best, I'll go get a big bag of it later.
Well, I mean, that's how I pick what flavored Cheerios I'm going to keep buying, you know, like I get, it's not really ridiculous to think
Yep.
about that.
It's not ridiculous until, you know, they're cleaning up diarrhea at 3:00 in the morning.
Well, yeah, exactly.
Like, what
I can
happened?
handle the apple cinnamon Cheerios.
Yeah, right?
So my, I mean, my pets eat, like my cat's eaten the same food for 5 years. Like it wouldn't occur to me to do anything different because that's how we're trained. And my husband had to go shopping for his mom, his cat lady. And he came home, he's so pissed because she gave him literally like 16 flavors of Fancy Feast. And I'm like, couldn't you just pick? He's like, no, she wanted 2 of Ocean Gravy or whatever. Oh my God.
So
and you got
real.
to go through the checkout while everybody judged you.
Yep. And that's what's, and I think those are the things that's actually kind of cool for me to see, and why I still answer questions on the dashboard, because the level of care that some of these people put into their pets. When and I said it earlier and I'll say it again, like our doctorate is in medicine. Miss Jones knows her cat.
Yeah.
She knows her cat. She knows that her cat thinks that because it's Tuesday, she gets white ocean fish, and on Wednesday she gets shrimp. And just, there's that level of care. It's the same level of care I put into feeding my human kids.
And instead of being frustrated, like how cool is that to acknowledge you have this person who's so vested and they're trusting you to help them, you know, continue that relationship.
So cool. Yeah, it's an amazing, it's my favorite job. Like I love my clinic job. I love my clinic team. But I have to take dollars from people there. Yeah. And that can be stressful. But I mean, even in the cases where it's a pet that's agonal and a pet owner is texting into us and we're walking them through, these are the things that you're going to see. This is what's happening. And being there, leaving the chat open for however long we need to until they say thank you. And being there with them is such a different feel from being the one to push the plunger. It's so different from having it be transactional.
Yep.
That it really does feel like you get to be there for that pet owner without kind of the money part muddling it up.
That was the one part when I was doing in-home euthanasia. I was like, we just got to collect this beforehand.
Yep.
Because we weren't for a while. And I started to judge like how much work I was going to have to do mentally by how many cars were out front. And I pulled up to this house and there were like 12 cars. And I was like, oh boy, okay, this person, you know, has some trauma. That's okay. And so I walk in and, you know, the whole thing, and she was processing the death of her golden, and her father, I guess, had died the year before, and she still had a lot of trauma about that. It wasn't gentle. And so I'm like, no pressure. So I hit the maid. But I went through my whole thing, and it's like the easiest medical thing, the hardest thing to do well from a communication standpoint, because of course when you're there you hear all the awful things that happen to them at some point with some euthanasia that went bad.
Yes.
That's never
like, okay, here we go.
And right, there's this great heaving sobs, and I'm, you know, standing back, and she's over her dog, and you know, she's shaking, and then she takes a breath and she looks up and she turns to me and she goes, that was awesome. And I'm like, really? But I literally saw weight leaving because she had so many horrible things, so many ideas in her head, and so many fears about the awful trauma that this moment was going to bring. And then to realize that it wasn't. Like, it was probably like the best moment of my the best moments of my career have been in euthanasias.
Absolutely. Some of the quality of life discussions that we have online, like even just reading them, move you to tears. I mean, it is amazing. Like these, being able to really walk them through. I'm thinking of specifically, I usually do like the 10 p.m. to 1 a.m. shift, and I get like a lot of dudes on that. Like it's so funny because I don't know why, like random dudes are always up late chilling with their cats. I don't know. And this guy was like, it's so cool. Like, he's like, I broke up with my girlfriend and now this cat is all I have. And I've never had to get a cat euthanized before. And I just don't want her to hurt. Can you just talk to me? And that was his question. Can you just talk to me? And so you get to have all of this time with them. And we do our best in the clinic, right? But in the back of our mind, it's, oh man, my next appointment has started. Oh man, I'm running 15 minutes behind, but I know this is really important. But that energy goes into the room. And during those chats, when I'm like, you know what, Bob, I'm going to give my sole attention to you. Let's just talk about it. Let's talk about the cat that Fifi used to be. Let's talk about the cat that she is now. And so really being able to guide that pet owner so that when he walks into the clinic, I tell people the hardest phone call for a pet owner to make is, I have to euthanize my pet, or I think it's time. And even in hospital, like, if the first thing out of your mouth isn't, oh my God, I'm sorry, like, why are you here?
I didn't realize when I was doing that, we had always thought, you have to be on the phone. That's an important thing. But as soon as we opened up text,
people text everything.
This is what happened. I'm like, okay, that actually makes total sense.
Yep. You can text when you're crying. It's harder to talk on the phone when you're sobbing and you think that your world is dying, right?
You sure as hell not going to get on video.
No.
I'm an ugly crier. Like, my eyes
like your nose starts running.
Naughty.
Bad. It's real bad. It's bad. But yeah, and so, yeah, I mean, again, nobody ever chooses video, especially at 2:00 in the morning. Nobody wants to be on video.
So, top 5 qualities, because I know I've totally taken up more of your time than I said, but this has been so great. So thank you.
No worries. Yeah, no worries.
Top 5 qualities of a successful veterinarian who's going to be able to do telehealth well.
Dealing with ambiguity is number 1. Number 2, being able to talk through your plans, or if this pet were in front of me, here's what I would be worried about. Being able to accurately put words to how you feel.
How you feel, not
Yes.
Interesting.
Because the clients that are coming in, texting, chatting, not doing video, want to feel felt.
Yeah.
And if they don't feel that you feel them, you're missing a whole part of that interaction.
Yep.
So is that 3?
That's 3. You don't have to do 5, I bet.
High-speed internet.
Yeah. Oh my God. Can you imagine in the middle of I think my pet's dying, and then you just
like, oh, lost connection. Oh my gosh. And then I would say you have to have an overwhelming sense of being able to listen. Understanding that just because you're a doctor doesn't mean that you know everything about that animal. Having a real respect for what the pet owners are telling you, because they know their pets better than we will ever dream of. Even if it's a client that I've been seeing for years, I get an hour and a half of their life a year, right? On a good year. If it's a bad year, then they're a frequent flyer and I see them a little bit more. But truly, if they say something's wrong, believe them, talk them through it, believe them. So you have to be able to say, gosh, I may not know everything. So yeah, I think that those are, for me, the top 5.
Not being the person who's just thinking ahead of the next thing you want to say.
Mm-hmm. That's right. Listen. You have to be able to listen.
Those clinicians, like you said, who are good at this are probably really good in the exam room too. High in demand people.
Yes. Yes.
Oh, well, thank you so much.
It's so fun. We really need to do this next time with wine.
Yeah, I know. Well, we have to do our happy hour. I haven't had one yet this time.
Come on.
All right. Thanks again, everybody.
Thank you
again, Dr. Roth.
Yeah, thank you, Jessica.